Hello and welcome to Chapter 7 of your Pathology book. We're going to be talking about endocrine pathologies. And if you will recall from your endocrine system in Advanced Anatomy and Physiology, exocrine glands secrete products into ducts that empty into the body cavities and into the hollow center of an organ or onto the surface of the body. Examples of exocrine glands are sudoriferous glands that secrete perspiration, your sweat, sebaceous glands that secrete oil onto your skin and your scalp, and ceruminous glands that secrete earwax. Other examples of exocrine glands are digestive glands, which secrete digestive enzymes into the gastrointestinal tract, and mucus glands, which secrete mucus in a grand majority of the orifices of your body. Endocrine glands are also known as ductless glands, secrete their hormones into the surrounding interstitial fluid or into the nearby capillaries into the blood, and they go directly to affect nearby cells and tissues. Endocrine glands include the adrenals, the gonads, which are the ovaries and the testes, the pancreas, parathyroids, the pineal gland, the pituitary, and the thyroid. As a reminder, your pituitary gland is divided into the anterior lobe and the posterior lobe. And the anterior lobe produces the bulk of the hormones we are going to be studying. The anterior lobe has a hand in growth hormone, which helps you not only grow and develop as a child into an adult, but also in skeletal regrowth, muscle repair, and general body tissue repair. Fun fact about growth hormone is that it only couples with the chemicals that it needs to affect developmental changes and repairs in the body during your sleep cycle. If you are not getting enough sleep, your body is unable to repair itself. So if you're waking up 2 hours early to go work out in the gym, make sure you've had at least 6 hours of sleep before that. Otherwise, all of those gains that you think you're making in your muscles are very likely not going to happen. The anterior lobe also produces TSH with your thyroid. This is thyroid stimulating hormone. ACTH, which is adrenocorticotropic hormone for the adrenal cortex specifically. This image shows the adrenal gland for cortical hormones. This is actually affecting mostly the adrenal cortex. FSH, which is follicle stimulating hormone. This goes both to the testes and the ovaries, as well as luteinizing hormone. It also produces prolactin that goes to the breast glandular tissue. And the posterior lobe is responsible for oxytocin and ADH, which is antidiuretic hormone that goes to the kidneys. It has to do with water reabsorption and also calcium in the blood. Oxytocin not only helps smooth muscle contraction, especially in the uterus, it also helps with letdown of milk for lactation when breastfeeding. And it is also the feel-good chemical. Oxytocin is stimulated within 20 seconds of touching or hugging someone and is known to be one of the primary chemicals that makes couples feel lovey-dovey. The more touchy-feely you are, the easier it is for you to relax and become de-stressed and feel attracted to your partner. This is just a reminder that neurotransmitters are chemicals that your nervous system controls, but the exact same chemicals that are being put out by the endocrine system are called hormones. They are chemically the same. Neurotransmitters come from the nervous system and are found in between the synapse of nerve cells, and hormones are secreted in the endocrine system. I am going to include in your resources for the week section, your extra resources, the Advanced Anatomy Endocrine System lecture. If you feel like you need an overview of the endocrine system, feel free to watch it. It is not mandatory, but we are going to jump directly into endocrine system pathologies for this chapter. So if you feel like you need an overview again and just want to go back over the basic facts and hear the lecture, please feel free to go over to that. All right, so since the pituitary is responsible for a ridiculous amount of hormones, it makes sense that we would start there with diseases of the pituitary gland. The first one we're going to cover is gigantism. Gigantism is a form of hyperpituitarism, so it's an over-secretion, and it's the result of the overproduction of specifically growth hormone during childhood years before the onset of puberty. Gigantism is really rare, with approximately 3 to 4 cases per million in the population. A child with gigantism experiences abnormal and accelerated growth, mainly in the long bones. Because of the prevalence of pain associated with enlarged bones, joints, and associated muscles, like think of growing pains times 100, the therapist needs to inquire about pain levels before each massage session. Be sure to request client feedback about levels of pressure and tolerance. Another form of hyperpituitarism is acromegaly. It's another result of overproduction of growth hormone, but this is done during the adult years after the onset of puberty. This condition causes an excessive growth of connective tissues. Now remember, your connective tissue is like 70% of your tissue already. It is relatively uncommon, with about 70 cases per million. And this disease is associated with a decreased life expectancy. As with gigantism, because of the prevalence of pain associated with enlarged bones, joints, and associated muscles, the massage therapist needs to ask about pain levels before and during every single massage session. This condition often has coexisting medical conditions such as carpal tunnel syndrome, hypertension, and diabetes, so please be aware of those and their potential contraindications. Another issue with growth hormone and gigantism is local gigantism, when growth hormone has targeted a single area, usually in the hands or the feet, usually in the digits. So specifically fingers and toes, sometimes entire legs can be done, but it is usually in the limbs, in the appendicular skeletal region. You'll see them in the most distal portions of the body. Hypopituitarism in relation to growth hormone is dwarfism. So when we get hypersecretion of growth hormone, we get gigantism. And when we have a hyposecretion, we end up with dwarfism, for short stature, which is an underdevelopment of the body. There are no contraindications or considerations specifically for dwarfism. Sometimes dwarfism comes with not only thickened limbs, but also bowed legs. And in this instance, massage might be indicated for shortened or pained muscles due to postural imbalances. But otherwise, dwarfism itself has no other considerations relative to any other client that you might see on average as a massage therapist. All right, now we're going to focus on diseases of the thyroid. The first one we're going to discuss is a goiter. Any enlargement of the thyroid gland is called a goiter. This enlargement can occur in puberty, during pregnancy, or in response to an iodine deficiency. Fun fact, that's why your salt is iodinized. It has iodine in it. It is one of the most important advances in food safety in terms of keeping you healthy through your diet. Both vitamin C for scurvy and iodine for your thyroid, which is in your salt. Goiters are pretty obvious by the large mass in the neck. When it comes to massage therapy and goiters, the anterior neck or throat region is an absolute area of caution, and any type of pressure in this area should be avoided. Massage was reported to have contributed to the development of thyrotoxicosis, which means a hyperactive thyroid gland, also known as Graves' disease, which we're about to talk about. There's been a systemic review of massage safety, and it's been found that massaging the anterior neck or throat of the area of the body is most commonly associated with serious adverse effects. Another thing not mentioned in this, because it is not an endocrine system issue, but massaging too deeply on the sides of the neck, especially when you are trying to stimulate the sternocleidomastoid. If you press in too close to the carotid artery, you can actually let loose cholesterol or plaque inside of the vessel, and you could potentially cause things such as a heart attack massaging the neck as well. So the neck is absolutely an area of caution. All right, so you've rubbed too hard on your client's neck and you've given them Graves' disease. Congratulations. Graves' disease is characterized by a hyperactivity of the thyroid gland with a resultant goiter. With overproduction of thyroid hormones, the metabolic rate can increase by 60% to 100%. Graves' disease is also known as hyperthyroidism and thyrotoxicosis. Some of the disease manifestations are anxiety, hand tremors, you'll see a slight hand shake, weight loss despite normal food intake or even increased food intake, fatigue, insomnia, tachycardia, the heart's beating too fast, flushed and warm skin, sometimes with profuse sweating, heat intolerance, they'll feel too hot, they'll start losing their hair, they'll get brittle hair, and very often they will get a goiter in the neck and their joints become hypermobile. When it comes to massage and Graves' disease, surprise, surprise, the anterior neck or throat region is an area of caution, and massage pressure over this area should be avoided. The major things to consider are avoid overheating the client. So you're going to want to use very lightweight sheets, only a single sheet, uncovering the arms and legs perhaps during the session, a cool washcloth or cold therapies. Do not use heat packs, heating pads, a table warmer, or hot stones on these clients. It is suggested to possibly use an oscillating fan to keep moving air on the client. And if they have dermopathy, if they have a pathological issue of the skin because of Graves, use an emollient lubricant. So use a very oily, thick, like shea butter or grapeseed oil lubricant to help combat skin dryness. If the client's hands begin to tremble, place them palm down in a small pillow or folded towel to help keep them steady during the massage and comfortable. Hashimoto disease is because of an underactive thyroid gland, which leads to a thyroid hormone deficiency. Hashimoto's develops slowly over many months or years and is the most common cause of hypothyroidism in the U.S. Disease manifestations include fatigue, muscle weakness, reduced metabolic rate, cold intolerance, weight gain, slowed mental processes, cool, dry, and scaly skin, and the loss or thinning of hair. Other signs can also be a goiter, an excessive edema or swelling of the face, hands, and feet. The edema is non-pitting, meaning if you press your finger against it, it will not stay compressed. It is a firm type of swelling, and there are distinctive facial changes such as a bulbous nose, and the lips start to swell. You may also see a thickening of the tongue, a smaller than normal thyroid, and inflammation of the upper GI tract. So when it comes to massage and Hashimoto disease, again, avoid the neck and throat, please. The anterior neck, just avoid it. Absolutely avoid it. Unless you become significantly trained in treating something such as whiplash injuries, just avoid the anterior neck for now. Determine your client's level of vitality, how robust they may be. Frail clients might require different modifications, fewer changes in body position, massage techniques of lighter pressure and slower speed. These clients chill easily, so you want to make sure that they have a warm blanket in addition to the sheet, perhaps an electric table warmer or electric blanket. Also use an emollient lubricant like a thick oil or shea butter for dry skin for these clients. You can also have a pathology of the parathyroids. Hyperparathyroidism is an overproduction of the parathyroid hormone PTH, and this often results in an elevated calcium level in the blood called hypercalcemia. Hypoparathyroidism, you guessed it, has a diminished function of the parathyroids, leading to a low blood calcium level. The massage considerations for diseases of the parathyroids are the same as they are for diseases of the thyroid. This image shows you some of the visual differences and body function differences between hypothyroidism and hyperthyroidism. On the hyper side, you see thinning hair, the eyeball protrusion, an enlarged thyroid leading to a goiter. Heart failure caused by tachycardia, meaning your heart is beating too fast. Weight loss, diarrhea, heat intolerance, they feel too hot. You see that the hand is pink that is being pointed to. It is red, trying to get rid of excess heat. They have warm skin, sweaty palms, and they have hypermobility, not only of the joints themselves, but also in the reflexes. They may have spasming or jerky movements. For hypothyroidism, we also see loss of hair as it turns coarse and brittle and breaks off. There's periorbital edema, so there's swelling around the eyes. In the buccal region, we have a puffy face. You see the skin is hanging and sort of swollen with fluid. The thyroid is a normal to small size. They also have potential heart failure, but this time through bradycardia. It is a lowered, slower heart rate. They have constipation. Peristalsis slows. There's some issues with water absorption. If there's issues with the parathyroid as well with this, then you're also going to have calcium issues. They have a cold intolerance. They get very cold very quickly. They have muscle weakness, swelling. They have edema of the extremities. You can see how swollen the leg looks on the side with hypothyroidism compared to hyperthyroidism. Next up are diseases of the adrenal cortex. First, we're going to cover Cushing Disease and Cushing Syndrome, which are the result of excessive amounts of cortisol in the blood, either caused by hyperpituitarism, which can lead to Cushing's disease, or the use of corticosteroids, which might lead to Cushing syndrome. Both Cushing disease and Cushing syndrome are forms of hypercortisolism. If you look at your textbook image here on the right-hand side, you will see representations of symptoms of Cushing syndrome. I will try not to feel attacked as I age. You have thinning of scalp hair, emotional instability, acne, moon face, increased facial hair. A buffalo hump can develop on the back. It looks like a dowager's hump, but a little bit smaller. This is actually in between the neck and the shoulder, more so than on the back of the top thoracic spine that you would see in a dowager's hump. This buffalo hump is exactly what it looks like, the hump between the neck and the shoulder. Osteoporosis can develop, thinning of the bone, cardiac hypertrophy and hypertension, so we're looking at increased blood pressure. You can have hyperplasia or a tumor on the adrenal cortex or the adrenal glands. Truncal obesity, you can see obesity in the lower portion in the abdomen, the belly, and the trunk of the body. Striae of the skin, you can see stretch marks and striping of the tissue. Easy bruising, muscle wasting, there's weakness. You can get thin extremities. So even as the midsection is growing, the legs and potentially the arms get smaller. And you can also end up getting diabetes as a coexisting condition. Now, in relation to massage therapy and those with Cushing disease or syndrome, you need to determine your client's level of vitality. Again, just check in on frail clients. Ask how fragile their bones are, if they've had any bone density tests or frequent fractures. This will determine whether or not you need to take special precautions for osteoporosis or any other coexisting conditions that go along with Cushing's. You will need to avoid using aggressively applied passive stretches and joint movements if they have decreased bone density, or skin thinning. Because of the skin thinning, you want to use a large amount of lotion or oil because you do not want any friction or skin damage with these clients. Now, this is all from hypercortisol production. Now we're going to talk about hypocortisol production, which represents as Addison disease. Now, Addison's disease is a result of failed adrenal functions, often from autoimmune diseases. It can also come from local or general infections or adrenal cancer. Those with Addison's disease can experience personality changes. They may have anorexia, nausea, vomiting, making it difficult to eat. Hyperpigmentation, you might see skin bronzing. Cardiac insufficiency, hypotension, so they have very low blood pressure. Adrenal atrophy, they have potential autoimmune infections, tumors. They will have diarrhea very often. They will have intense abdominal pain, and they will also have frequent muscle weakness. Now, with massage therapy and Addison disease, you're just going to check for the client's vitality. They do not have the same skin thinning issues that you do with Cushing's, but you do need to watch out for frailty, especially with those with intense muscle weakness. You want to use massage techniques that have lighter pressure and slower speed. A very common condition that you are going to see in your clients is diabetes. Diabetes is a situation where you have a lack of insulin, and without insulin, glucose cannot enter the cells, which is bad news because not only your body but your brain lives off of glucose. It's the main source of fuel and energy for movement, growth, repair, and many other functions. If you have a client coming in with type 1, ask if the client carries a glucose monitor or glucose tablets or gel, and if so, where they are in case they're needed during a possible hypoglycemic episode. Signs and symptoms of hypoglycemia and first aid measures for this condition are discussed in the caution module in your chapter 7.1. Please check that out. That is in 7.1. Clients who are type 1 are insulin dependent, so avoid vigorous massage or heat and ice applications over sites of recent insulin injections. You need to avoid these areas as a local contraindication for 24 hours. A cool study was done, and they did find that massage therapy increases insulin absorption. However, that increased absorption, it could contribute to complications like hypoglycemia. See clinical tips 7.2 in your book, please, if your client is using a drug pump and how to appropriately massage around it. We will discuss that in just a moment. In type 2 diabetes and also in other conditions like insulin-resistant PCOS, your pancreatic beta cells produce insulin, but your cells are resistant to it. This is called insulin resistance. In rare cases, the body does not produce enough insulin. 90% of your diabetic patients are going to have type 2 diabetes. If one of your clients comes in with an insulin pump, all right, you are going to avoid the pump itself, the tubing leading to the insulin delivery site, and the glucose sensor. There's also a data transmitter that will send glucose readings to the pump through wireless technology. All right, so if you look at this image here that we have up, all right, B is the tubing, A is the pump itself, C is the glucose sensor, and D is the transmitter. Avoid vigorous massage, heat and ice applications over the infusion site. If they are wearing it, don't get any oils or lotions or anything around this area. You do not want to mess with any of the adhesives that are sticking this to your client's skin. Just gently work around it. Ask if they can clip the pump to their undergarments if they are wearing them underneath the sheet, and help adjust for lying prone. There are several complications that can arise after the onset of diabetes that you need to watch out for in your clients, such as neuropathy, no feeling in the fingers and especially the feet. They may not feel if they have been injured, which can lead to infections and possible gangrene. There is diabetic retinopathy. There's cataracts that can develop, glaucoma, periodontal diseases, kidney diseases and conditions, including kidney failure, cardiovascular diseases and conditions including hypertension, occlusive high cholesterol, peripheral arterial vascular disease, neurologic diseases, including stroke is very possible, fungal infections including thrush, jock itch, vaginal yeast infections, and athlete's foot. So please always ask your client about their diabetic complications and modify your massage accordingly. Complications associated with diabetes are far less common and less severe in people whose disease is well controlled. So if your patient or client knows that they are diabetic, but they're not currently controlling it, they may not even be aware of some of these things. Remember, signs are things that are observable but not necessarily felt by the client. Your client might not be aware that they have extreme high blood pressure or high cholesterol and potentially are at risk for a heart attack or stroke. These are things that they don't feel until symptoms start occurring, like chest pain or sweating or heart palpitations that can be felt. So please keep an eye on those things. And again, if you want to check out your extra resources, I will include a review of the endocrine system for you. Have an excellent week.